Have you noticed any changes in patient satisfaction or retention since implementing the virtual assistant service?
Yeah, absolutely. So, I mean, this might sound somewhat silly, but in the PT world, the physical therapy world, it's somewhat easier than you might think for patients to fall off the schedule. So perhaps they forgot to make follow-up appointments if they canceled their last visit, or if, let's say, they ran out of authorization. Our VA is on top of everything. So she's trained to track when patients are out of authorizations and prompts us to do what we need to do in order to facilitate new authorization. um, Also, she's tracking which patients, active patients, perhaps don't have any scheduled visits. And so there's spreadsheets that she updates routinely that we check, and we give her feedback on whether or not we want her to reach out to those patients. So, it's been great. Patients love the fact that we're in constant communication with them. And she's really implementing a lot of that.
So it sounds like having a healthcare virtual assistant actually helped to improve communication with patients because now you're able to have more touch points, follow up with patients that have fallen off. And it actually sounds like treatment plans might be being followed through even better because you guys are able to make those detailed follow ups and then also still work with patients that are in your clinic as you continue to grow and scale.
Yeah, and it's what's interesting is I had mentioned earlier that through the messaging application, which a lot of patients actually prefer, if the VA has to make a phone call that has her sometimes on hold for a half an hour, she's still able to send out these messages. So she's kind of killing two birds with one stone. She doesn't have to wait to hang up the phone call with an insurance company to maybe call a few other patients who fell off the schedule. If they have downloaded the app or they've communicated with us through messaging, she's doing these things simultaneously. So it's very efficient.